Clearly, there's evidence that people who exercise actually respond to infection better, respond to vaccination better. So that's all been documented.
I see.
I cannot speak to the specific studies, but there is.
Do you have a sense of mechanistically why that's the case?
It is so complex, I would say. I would not be able to tell you. But that being said, I think the whole line of investigation to induce thymic rejuvenation, I think, is an important area, especially if we're thinking about increasing lifespan, further for what we are doing now. That in the future, it will become one of these rate-limiting steps. It's a bit the same situation as the ovary, where, these are the ovary and the thymus are, we call them the canary in the coal mine. I mean, they really are specific organs that show accelerated aging way earlier than other tissues. Now, the question is, why is the thymic involuting so early? I think it's probably because evolutionary, we were never meant to live this old, and so that really is one of the thinking that goes on. That's going to be in the long term one of the problems that we have to face. And this is something we're actively studying in the lab. We just completed a study where we are looking for novel biomarkers that are predictive of whether you will respond to a vaccination or not. And this is something done in collaboration with Mark Davis at Stanford using the 1000 Immunome Project, which is one of the largest studies studying aging in the immune system, only in humans. And so we've been able to studying people to identify some metabolites that are associated with poor response to vaccine. And so those are not only markers, but they could also become tools that we include as adjuvant or as a pre-treatment therapy. I'm sure you're familiar with the work of Joan Manick.
Of course. Yeah, I was going to ask you about Manick and Klickstein in a moment. But before we do, I want to go back to this point here, which is biomarkers are so important. And when I think about cardiovascular disease, and even though it's the leading cause of death, why I tell my patients it's the one you need to be least afraid of if you're willing to be proactive in management. And it comes down to the fact that we just have such a clear understanding of how the disease works, and we have exceptional biomarkers. Right? So we can measure the things that are causing the disease. We can measure inflammation. We can measure ApoB. We can measure VLDL cholesterol, LP little a. We can measure blood pressure.